Welcome back to the Gary Sutton Show on WSBA. We're going to be joined in just a moment here by a lady who's the president and CEO of National Family Planning and Reproductive Health Association. Her name's Claire Coleman. And the 50th anniversary of birth control legislation is approaching. And the National Planning and Reproductive Health Association, National Family Planning and Reproductive Health Association, is putting out results today of a recent poll that shows widespread support for increased family planning funding. The survey reveals that most women agree that access to birth control is an essential part of a woman's preventive care. We're going to be talking about that in just a few moments, but the case that is the source of this 50th anniversary coming up is called Griswold versus Connecticut. And it originated, by the way, as a response to an act in Connecticut called the Comstock Act back in 1879. Now, the law basically disallowed the use of any drug, medicinal article, or instrument for the purpose of preventing conception, and subjected the prosecutor to be fined not less than $50 or imprisoned not less than 60 days, nor more than 1 year, or be fined and imprisoned, or be both fined and imprisoned. Although the statute was never, ever enforced, Massachusetts and Connecticut were the only two states in the Union that still had these types of statutes in their legal documents at the beginning of the 1950s. The first Planned Parenthood clinic in Connecticut was opened in 1935 in Hartford. It provided services to women during that time, including the Waterbury Clinic that led to the legal dispute that came up in Griswold versus Connecticut. Several clinics were open along Connecticut for the next few years. And in 1939, this clinic was demanded to enforce the 1879 anti-contraception law towards poor women in the area. This brought the attention of some leaders that remarked that the importance of birth control among poor women, in which the lives of patients depended on it, not being successful until 1965, 16 years later for the first judicial restriction. And so we're going to talk about that this morning, that the anniversary of this particular case, Griswold versus Connecticut, and we welcome to our show Claire Coleman, who is the president and CEO of the National Family Planning and Reproductive Health Association, with the results today of that survey out there. Good morning, Claire. How are you?
Good morning. So nice to be with you, Gary. Thanks.
I know you're a busy person today putting out these results and a lot of interviews, but talk a little bit about the survey, because I'm sure there are some people who look back and say, well, geez, I don't know if that was a good thing at that time, but, talk a little bit about family planning and some of the results that came out of this survey. First of all, how women feel about having contraception be a part of their particular family lives.
So NIFR's national poll shows that American voters, women voters, regardless of political affiliation, are strongly in agreement about the importance of contraceptives in their own lives and about the importance of having contraception be available to people who can't afford to purchase contraceptives on their own. They're strongly supportive of federal funding. 68% of women voters, again, regardless of their affiliation, see this as core to their own health and their family's security, and they want to make sure that resources are available to help people who don't have the funds to afford their contraceptive options to be able to get those folks the care they need as well. It's really important results that show that, again, particularly at the federal level, policymakers are very out of touch with American women's views on contraception.
Does this tie in at all with abortion, and if so, how? And if not, tell me.
I think for a lot of folks, the notion that contraception it gives them an opportunity to think about when and whether they're going to have a family and then how far apart they want their children to come is so core to their values that they don't understand the political debate that has tied contraception and abortion together. There's no question that opponents of abortion have increasingly included contraception in their opposition. But for people who are living life and thinking about how they and their partner want to raise a family, or if they're staying single, how they may not want to raise a family, these issues are very disconnected for American women. And I think you see extremely strong support, again, for this notion that people should be able to do what's right for them, bearing on their own individual circumstances.
You know, Claire, as I look at this, and again, I'm looking at it not really with a closed mind, or I'm really listening to what you have to say this morning, but I'm thinking to myself, it's an interesting dichotomy that you have here. For example, you say, well, people should be able to make their decisions about their families and so forth, and I would, I certainly understand that. On the other side, you say, but if we don't make good decisions right here, or somehow we screw up, or somehow, we don't want the government involved in telling us that we can't have abortions, yet at the same time, we do want the government involved in funding, and the government being taxpayers, in funding something that many people may have a difficult time in funding. So you see where it's kind of a dichotomy here in terms of, do I have individual responsibility for my family? I would say, yes, I do. But then I go out and say, but then the government and everybody who puts money into the government has to support that. How would you react to that?
In lots of ways. So the first thing to say is not nearly half of all pregnancies in this country are unintended. It doesn't mean that they're unwanted. It may mean that they're coming at a tough time for a woman. And so if this is not an issue just of the folks who are lower income and perhaps struggling from day to day. All of us in America struggle with the notion of intending pregnancy. And intended pregnancy is a public health matter.
Right.
So one of the reasons why there's so much strong support for increasing access to family planning care is because when women have children that are not intended and timed, those moms tend to have poorer health outcomes, and so do the children they bring into the world. The most notable place this shows up, and this is true in Pennsylvania, but it's true in all 50 states, is in the cost of the Medicaid program. When a woman of low income becomes pregnant, she doesn't have insurance, that pregnancy automatically entitles her in every state in the country to Medicaid care during her pregnancy. That's because the state, the government, has an interest in protecting her and the pregnancy as it develops, because we're paying the cost as a society for high-risk delivery and complications related to unintended pregnancy. Family planning saves money, and it doesn't just save money for poor people through your tax dollars. It also saves money for insured folks. It's one of the reasons why insurance companies have long covered a full range of contraceptions, and now they're required to do so under the Affordable Care Act, or Obamacare, as some people call it, because contraception saves money, and importantly for those of us who work in this field of healthcare delivery, it improves outcomes. Women are healthier and their kids are healthier, and that's better for us, it's better for our economy, and it's better for our society.
I hope you don't mind me playing devil's advocate for a moment, but let me be devil's advocate
again. No, I'm
glad
that you are. Such an important topic to delve into.
It is a very important topic, and I love to debate. I mean, I love to talk about the pros and cons of this, because you explained it very, very well, by the way. The responsibility factor. Okay, a lot of people would say that a lot of our laws in this country right now are moving in the direction of bailing us out of having to have responsibility. We know that we are given rights. If you believe our founding fathers, we're given rights by nature, but we also are guaranteed those rights by our Bill of Rights and so forth. But the idea has always been that those rights come with a certain amount of responsibility. Obviously, there's no rights written in there about family planning or anything like that, but I'm sure there are rights that, allude to that along the way. Do you think that any of these kinds of laws that are coming along right now are taking away the individual responsibility of families? Do we see that? And a lot of people say we're sliding down the abyss here in terms of some of our moral responsibility. Your thoughts about that?
Well, I would say one of the things we're noting this weekend is the 50th anniversary of Griswold versus Connecticut. So that's a Supreme Court decision, and you mentioned it as you introduced me, that said that married people had the right to make decisions about contraception because it was in the intimacy of the marriage.
Right to privacy
Neither
situation.
that decision nor any other decision since has said the government then has to subsidize, but the government has many responsibilities. In part, it has the responsibility to protect the public health. The U.S. Centers for Disease Control has said that family planning is one of the 10 great achievements in public health of the last century, not the century we're currently in, but the last century. It has driven down maternal mortality rates and driven down infant mortality rates. Women have fewer children, they die less often from pregnancy-related complications, and they die less often after pregnancy. And so do the babies they bring into this world. So I think there is a sense of responsibility that is shared across the society. Again, half of the pregnancies in this country are unintended. This is not a question of low-income people being the folks who aren't living up to their responsibility. We all struggle with the notion of intimacy and sex and intendedness in our relationships. For many women, we live for the day of that positive pregnancy test. That's true no matter what our income level is and no matter what our family circumstances are. And so together as a society, we try to make good decisions for ourselves, and sometimes we don't make great ones, and the public health service steps in to help support people in need. I think that's a very important responsibility. It's a shared responsibility in our society, and investing in family planning has worked out brilliantly, both for the women and families who've been supported by these programs and for the public health.
Talk a little bit about Title X. I know that family planning care has had some recent funding cuts that have come up, but I'm sure you got a very definite point of view on that.
So Title X was enacted into law by Richard Nixon in 1970, and it was part of the government's response to increasing poverty levels in the country and a concern that if you weren't able to access contraception, again, Supreme Court had made contraceptive legal 5 years earlier, but they weren't within reach for a lot of poor people. So in 1970, Nixon supported the enactment of a broadly bipartisan law that said, you know what, we should subsidize care for folks who can't afford contraception but want to be able to plan their families. So that's the Title X program. It works in all 50 states and in the territories. The networks are designed locally. So in Pennsylvania, there are 4 separate Title X networks that work collaboratively and cooperatively. The state government doesn't run any of these programs. They're run by private not-for-profits who compete for the right to distribute this money, and they together work with hospitals, community health centers, and other health providers, including local health departments, in order to make sure people have access points in the community. So if you're in York, you can go on the web and put your zip code in and search for the nearest health center. If you're a very low income, and what I mean by low income is under about $11,000 a year, your services are totally free in a Title X funded setting. As your income rises, the patients pay a share. We share the cost of services. But a patient who is under 250% of the federal poverty level, that's about $26,000 a year today, those patients never pay full fee. You can come into a Title X funded center with health insurance or a high income, and you'll be seen. It's an excellent place to get care. But the emphasis of the Title X program is to subsidize care for people who have the least. And so 70% of the patients seen in the system nationwide have incomes under $11,000 a year. They are very low-income people, and they're the only access points. For most of these patients, this is the only health care they get all year.
It would be interesting to know that on this number of people who are making under $11,000 a year, how many of those are, for example, teenagers who might still be living at home, who obviously are going to make under $11,000 a year. Is there any data out there that supports that at all?
There's quite a no. Well, no. The single 2 biggest categories of patients in the Title X program are women first between the ages of 20 and 24, and then women between the ages of 25 and 29. The next largest cohort are women the ages 15 to 19. So the bulk of the program resources are being targeted towards women in their 20s, and the single fastest growing segment of our population is women over the age of 40. That's been growing since the recession. We also see a fair amount of men. It's about 7% of the program. But men are also welcome in Title X funded settings. They can have sexual health exams and receive counseling and information about planning their families as well.
Do you have a few minutes with us yet? Or do you have to run to another? You have to run to another interview here. I hope we have you to 11 o'clock. Okay, or till 10 o'clock rather, not 11 o'clock. That would be a little bit longer than maybe you have right now. We're going to come right back here. Claire Coleman with us this morning, just until 10 o'clock, believe me. And she is giving us some information here on a brand new study that came out today and some results on that. Claire is the president and CEO of National Family Planning and Reproductive Health Association. And she's telling us about those numbers here on the Gary Sutton Show on News Radio 910 WSBA. She'll be right back. Welcome back to the Gary Sutton Show on WSBA with Claire Coleman, President and CEO of the National Family Planning and Reproductive Health Association. Claire, a lot of people probably aren't aware of the Griswold versus Connecticut case, but it did have far-reaching ramifications. Can you give us a quick history lesson here? This is the 50th anniversary of it coming up, and how the ruling impacted access to birth control today in this country.
Thanks. So Griswold v. Connecticut is a case that rules on Connecticut's obscenity law. So throughout the last century, states enacted and then over time invalidated laws related to obscenity and sexual health care, sexual access, information about contraception. Connecticut was one of the last states to have an obscenity law in place that said a physician could not discuss contraception or dispense contraception to a patient. And the Griswold of the case is a woman named Estelle Griswold, who worked at Planned Parenthood in Connecticut, and she, along with Planned Parenthood's medical director at that time, deliberately violated the law. They were arrested and convicted for violating Connecticut's obscenity law, and this is the case that went all the way to the Supreme Court. So in 1965, the court found that there was a zone of privacy, an area of privacy in this country that went to the intimacy of the marital relationship, and that decisions about whether or not to have children were within that zone. This was the first decision that linked privacy to sexuality and to intimate practices in family life. And so the court ruled that Connecticut's obscenity law was invalid and that physicians in the state could both talk about contraception with interested married patients and dispense contraception to those married patients. It took about 7 more years for the court to find that single people also had that same right. And so Griswold is part of a package of cases that includes Roe v. Wade that establishes this zone of privacy around reproductive health and procreation decisions.
In fact, they used the 14th Amendment to the United States Constitution, which states that, quote, no state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States, nor shall any state deprive any person of life, liberty, or property without due process of law, nor deny any person the equal protection of the laws. That's Amendment 14, Section 1. And, this was a law that they eventually brought down here in 65 that had started all the way back in 1879, which is called the Comstock Act, which I was kind of intrigued by. I was an old history teacher for 25 years before I did this. So I'm always interested in the history of how that comes around.
And this Griswold law was called a mini Comstock Act for many times.
Yes.
There's a federal Comstock, and then this was called a mini Comstock.
So the legacy of it today, 50 years later, where do we stand now?
Well, increasingly, the right to access contraception is being challenged and threatened. So from the Supreme Court's decision in Hobby Lobby last year, the Supreme Court ruled that some employers have a right to deny their employees access to contraceptive coverage in their insurance packages because the employer has religious objection. Some folks are finding that contraception is certainly too expensive for them to choose the best method. As I mentioned, we work very closely to support access to care for low-income people. And I'll give you just an example of what the funding cuts in Pennsylvania have meant.
Let me just jump in real quick on one thing, though, before you get to that, because I do want to hear that. But we had the Hobby Lobby case, and the Conestoga Wood Products is right down the road from us here. And I know some of the people who were lawyers on that case. And it wasn't that they disagreed with all of the contraceptive parts. They actually agreed with, I believe, 4 or 5, if memory serves me correctly. But there was a 5th one they did not agree with that came kind of after the fact. And so they said, our religion does not allow us to do that. And they have provided very nicely for their employees over the years. So, again, do we force someone to take on all of the things that are forced upon them, or do we say to them, okay, if you don't like that policy, then maybe you don't want to work for these people? I mean, isn't there room for them to have some conscientious objection there?
I think it's a question of whether or not women have the right to equal access in their health coverage as men do. And we believe that contraception is a matter of the public health. These are safe, legal, and effective drugs. And when you contract for employment and for health coverage, women should be treated equally in that health coverage. We disagree with the Supreme Court's decision in the Hobby Lobby. We believe that folks who contract for employment and receive benefit along with those employers should be able to access what's appropriate for them without having to provide any consideration or decision-making authority to their employers.
But they can do that. They just can't do it necessarily in that case totally with the help of their employer. I mean, and so they do have access to that, just not necessarily with the help of their employer. Unfortunately, with the end of our time, I could go with you for a while here. It's a fascinating discussion, and I really do appreciate the information you put out there today, Claire. Thank you so much for taking the time to be with us this morning.
Gary, I appreciate you giving me the chance to be here.
I hope we can do it again sometime. Thank you again, and we'll talk to you soon. Take care.
Thank you.
Claire Coleman with us here on the Gary Sutton Show. And again, matter of conscience, does that still have a place here? We talked a lot about the Hobby Lobby case last year and the Conestoga Wood Products, where they said, yeah, we'll pay for some of this stuff, but we're not going to pay for the after-the-fact kind of contraception. That's against our religion.